Here we have MRI of the leg in 70-year-old with history of acute swelling of the leg. We have got a coronal stir and T1 and axial fat sat proton density sequences. So what we see here is a well-defined large ellipsoid shaped abnormal signal intensity area measuring so and so situated in the posterior compartment of the leg. On T1 weighted image you can see there is peripheral increased signal intensity in the predominant low signal intensity. On fluid sensitive sequences, that is stir and axial fats at PD, there is heterogeneous intense increased signal intensity which shows a few areas of rounded low signal intensity. The margins or wall is thin and smooth and there is no evidence of wall thickening. There is no intra or intermuscular muscle edema, although there is mild subcutaneous edema. So looking at these features are very likely to represent a large hematoma. Features are unlikely to represent an abscess, but infection of a hematoma cannot be excluded on MRI. Post-contrast study may be of some use, but it will not really help to differentiate between hematoma and abscess without doing intervention. So I would suggest the clinical team to correlate with serial inflammatory markers and see if they are increasing or decreasing. If the inflammatory markers are normal or decreasing in size, so features are unlikely to represent an abscess. However, if clinically indicated, it's quite easy to perform ultrasound guided diagnostic aspiration, or it might be even able to do a therapeutic drainage if abscess is found. So in summary, we have a case of a large hematoma in the posterior compartment of the leg.